A very good afternoon once again. We apologize for the little technical difficulties we are facing right now, but nevertheless, let's start the discussion. As I mentioned, the Chamber takes a lot of pleasure in organizing this very timely and pertinent topic, and we have taken this initiative to bring you this forum as we believe that all of us must be rightfully informed and educated about the facts of this pandemic situation and how we can reshape our future to face these challenging times. I take great pleasure in welcoming our expert panel here today, represented by Professor Neelika Malavige, Professor and Head of Department of Immunology and Molecular Medicine of University of Sri Jawatanapura, Dr. Prasanna Gunasena, Chairman of the State Pharmaceuticals Corporation of Sri Lanka, and Dr. Upul Disanayake, Consultant Physician. The session will be moderated by Professor Saroj Jayasinghe, Emeritus Professor of Medicine, University of Colombo. On behalf of the Chamber, I wish to thank you all and appreciate your time to volunteer to speak at this webinar amidst your very busy schedules at this point in time. And we take a lot of pleasure in hosting you in today's session. We would also like to extend our appreciation to London Stock Exchange Group and Hutch for being our sponsors today. Before we begin, let me once again remind all our participants to keep their microphones muted and their cameras switched off unless they are speaking in this forum. We have also given you the opportunity to raise your questions through the chat box. We will be having a separate Q&A session at the end of the forum. We will be taking the questions coming in as much as possible. And the recording of this webinar, we will be uploading it on our Chamber Academy YouTube page, and the link will be shared with you all as well. Unfortunately, Dr. Saroj is having a little technical difficulty in switching on his video camera, but he is very well present here. So let me hand over the discussion to Dr. Saroj to take it on from here. Thank you very much. Dr. Saroj?
Yes, thank you very much. And once again, very good afternoon to all of you. And it's indeed a pleasure to moderate this session. And as Amanda mentioned, there are three stellar speakers today. You all know them. And we will first begin with Dr. Upul Disanayake. Then we'll have Professor Neelika Malavige, and then subsequently Dr. Prasanna Gunasena. After they make their short presentations, there'll be a Q&A, and I will moderate the Q&A, and we'll see how the ideas develop and the sort of points the experts wish to make. So it's my pleasure once again now to invite Dr. Upul Disanayake, Consultant Physician of the National Hospital of Sri Lanka, and one of the frontline physicians. You would have seen him in the TV before, and he will now speak to us on facing a crisis at home and work. Over to you, Upul. Thank you.
The crisis, ladies and gentlemen, come in different proportions. Say a crisis for me is not a crisis for you. So a crisis for me would be not having oxygen in my boat for 5 minutes. But for Prasanna Gunasena, it will be a problem of not having a consignment of vaccines not coming to Sri Lanka. So like that, the crisis come in different proportions. So the main thing is anticipate COVID. No one can certainly say that they have evaded COVID. Whether you are vaccinated, we are not vaccinated, they have taken a lot of immune boosting things. There is no way that you can guarantee you are going to evade COVID. People speaking in the background. Can everybody switch off their phones, the mic space? Yes, thank you. Right. So, our basis of having a COVID patient at home. Simple. Now, when you are well, like now, buy 2 oxygen cylinders, small size, or bio-oxygen concentrator, buy 2 tablets, 2 vials of tocilizumab, remdesivir 6 injections, dexamethasone 6 mg per day, enough stocks for 10 days, ceftriaxone 2 gram IV daily for 10 days. Ladies and gentlemen, I am joking. Don't believe me. This how some people sort of face a crisis. What they meant is that hoarding oxygen and keeping yourself ready for the illness, where if the tablets sort of are not available somewhere, the injections are available, they think that they can hold oxygen and tablets and does it in this all that. Say, because you are not going to be treated with this at home. And how are we going to do this? So be aware of symptoms. Now, the people with COVID it's some affects the throat, and the lungs and the trachea. So similar. That's one of the things. So these are the symptoms. Remember, in Sri Lanka is COVID. If you have any doubt, so do not panic, do not hide, and face the truth and get yourself checked with PCR or a RAT. But don't.
Upul, you are breaking up. Upul. Amanda, have we lost Upul or?
Yes, yes, I think he has a bit of an issue in terms of his connection. We are trying to sort it out from the backend.
Thanks.
Hello. Can you hear me now?
Doctor, it's a bit faint, but we can hear. You can even try switching off your camera.
Camera.
Yes, you can try switching
Can
off.
you hear me now better?
I think it's a bit better. You can go on, doctor. If there's an issue, we will let you know.
Right. So where did I lose you? Is it with the PCR and RAT and they will be not being 100%?
Yep.
Yes.
Yeah.
Right. So this remember that none of these tests are foolproof. If you at home, the other family members are considered positive unless proven otherwise. See, when your daughter is positive, if the mother has symptoms, you consider yourself positive. So when do you call a crisis at home? It's on the availability of resources at home and how resilient you are. Say when a person gets sick, if you have 2 people, 3 people, the whole household being sick is sort of different levels of crisis. So be prepared. So what are the things that you should prepare for? The requirements, the medical requirements, I would advise you to have a pulse oximeter at home. You can buy it for about 4,000 rupees from any pharmacy. I think it is price controlled at the moment. And if you have symptoms, you check or if you're positive, check your oxygen level every day at home, about 3 times a day, and see whether it is normal. Anything above 96 is normal. If it drops below 96, it's time for you to go to the hospital. And then it's important the psychology. There should not be guilty conscience. I am the one who brought this illness to the household, and blame culture should be stopped. Say you don't blame your spouse. If you want to blame it on the government, because the government forgives and forgets. And if you blame it on your spouse, there is no forgiveness. No, they will not forget. So don't blame it on anybody. Anybody can bring the illness to household, and so you don't blame people at home. Provisions. So think about the food and the medical, mainly the medical supplies. Now, if you are on a long-term medicines, people consult at home, say if you have high blood pressure, keep tablets for the next 1 month or so. And the food, prepare a way that you can obtain food. Say whether it is the provide, whether it is a family, and have a thing prepared beforehand, not when you are false. So when you get to know that you're talk to your neighbors, talk to your friends, talk to your relations, whether in an emergency what they can do. In Colombo, it is easy. There's a thing called what is it? And the for the food. And how are you going to treat this? Treatment, there is no treatment as such that you can take it at home. This is a controversial subject. I would, if one of my family members gets sick, I would be giving him paracetamol and a cough syrup only. And the prophylactic medications are not agreed upon by doctors, so don't experiment on yourself. And immune boosters. So there is nothing which has been found to immune boosting. Nobody has been able to evade it by taking the immune boosting drugs. Avoiding is the best way to the crisis. So if you want to avoid COVID, use mask indoors. If you want to avoid law enforcement, wear mask outside. So main thing is wear mask indoors unless you are at home. So this comes to the workplace. Yeah, it's different. It's different at different workplaces. It depends on the size of the workplace. But mainly, it's a risk stratification. When somebody falls sick, risk stratification is very important. Where was the person? Whether this was a closed, air-conditioned environment where there were a lot of other people, or where the person went to the canteen and had meals with other people. And educate your workers. Simply stay home if they are unwell. They don't have to have a runny nose and a cough. If they're unwell, stay home and inform the boss that there is a possibility that they have COVID. So have the contingency plan how to run your workplace. It's not up to me to say how to do that. Rotation work at different levels, categories, if possible, rotate the work and have the people working at home. So not keep because to, and then if you want to eat, ladies and gentlemen, we'll discuss this further when it comes, and I'll listen to the other speakers before we proceed further.
Thank you very much, Upul, for that outline. And now let's get on to Nilika, Professor Nilika Malavike, who will speak to us on facing a crisis and a glimpse of a future. Nilika, the floor is yours.
Yes, I have a presentation to share. I hope, and I hope I'm clear. Am I clear?
Yes, very clear.
Yes, you are.
Okay, thank you. We know we are facing a crisis, and how do we move forward? Thank you so much for inviting me to share my thoughts. Now, when we first had this COVID caused by SARS-CoV-2, it was a new virus. Everybody was so frightened because it was killing people, causing pneumonia. And when it spread from China to all over the world, we saw so many people dying. So the first reaction, this was unknown virus, of course, was to somehow get rid of it. and we thought it was possible. So we had very strict isolation and quarantine. We had extremely strict lockdowns, not just Sri Lanka, so many countries at different levels, various degrees of movement restrictions, and then the vaccines came, which when at the end of 2020, we thought 2021 is the year of vaccination, and by the end of 2021, we would have vaccinated the whole world, whole population, and we will be free of COVID and live happily ever after. But the happily ever after part didn't happen because of this emergence of variants. Until about September 2020, we thought that this virus was very stable, that it would not cause variants, and these vaccines that were developed by so many vaccine manufacturers would be the answer for us to live happily ever after. But however, with the emergence of alpha, beta, gamma, and finally delta, our hopes shattered. And of course, it is very well known that all these vaccines, the best ones, Pfizer, Moderna, AstraZeneca, this is a statement from AstraZeneca people itself, that is impossible to achieve herd immunity because Delta changes the game. Because Delta is so transmissible, and because of this high transmissibility, it is impossible to achieve herd immunity through vaccination and get rid of Delta. And of course, if you read all the news, it just says that it's a mythical. So it is unrealistic to ever think that we will get rid of Delta. Now, just to show where we are before we go forward, so this is just showing where we are. So Delta is present in 174 countries in the world. And the only countries it is not present, like in Africa and Madagascar, are the countries, and the Arctic, of course, are the countries which are not doing sequencing. So all the countries which do sequencing report Delta. And in all countries which report Delta, Delta is responsible for 100% of the infections. Okay, so it's not just that Delta is present in these countries, it is present for 100% of infections. This is because within a very short time period, because of its transmissibility, it wiped out all the other variants. Okay, so this is survival of the fittest, or evolution happening right in front of you. Okay, so Sri Lanka is no different, and this is our data as of first week of September, and we are also seeing Delta everywhere, except that in certain areas we do have a tiny bit of alpha left, which I believe by end of next week will be completely, these few alphas left will be wiped out, and we will have a Delta island like all other countries in the world. So now, as we understand, this changed the game. So when we understand that we need to live with COVID, then we need to change our strategy. And our earlier strategy was preventing infection, because when we prevent infection, then we can get rid of COVID and of course have a COVID-free world. But now all of us understand that it is not a reality. So now we have to change our strategy for preventing hospitalization and death. And this concept of sustained endemicity, which I'll touch upon. Now, these are the deaths happening around the world per million people. Of course, our Sri Lanka is a little bit colored, because we are having 5 to 10 deaths per million population. So are some other countries like Russia, Iran, and Mexico. But even in countries like Europe and so on, we don't have 0 deaths. And we know that America, Europe, and China, and these countries have fully vaccinated. This is not a single dose, but fully vaccinated more than 60% of their population. I mean, we are doing well as well. We have vaccinated fully vaccinated 40 to 50% of population. But of course, this does not completely get rid of this. But we know that Europe and America are almost back to normal. They're having huge football matches. People are unfortunately not wearing masks, and mask is not mandatory. And of course, they're having a huge caseload, but of course, very less deaths. And if we actually compare ourselves to these European countries or the West, Asia has been battered with infectious diseases for the last 40 decades, whereas these Western countries don't have that experience. They have forgotten how to actually handle infections. So I think we do have a cutting advantage over there, and so we have to come up with our own strategy how to move forward. Vaccination is the most important thing, but I just want to show a little bit about dengue, and just this slide for you to understand just one thing. Now, when this is dengue, spreading in Sri Lanka, and how it evolved. So this is just from 2006 to 2017, where we had the largest outbreak, and you can see it's just spreading like wildfire over the years. So when dengue hemorrhagic fever initially came to Sri Lanka in epidemic level in 1989, we had 203 cases, 20 deaths, with a case fatality rate of 9.8. So almost 10% died. But 2009, we had 35,000 cases and 346 deaths. Case fatality rate of 1%. And in 2018, we had 53,907 and 58 deaths with a case fatality rate of 0.1%. And just to let you know, the case fatality rate of untreated dengue hemorrhagic fever is 20%, okay, much higher than COVID. So Sri Lanka achieved this reduction in case, the number of people, proportion of people dying without any vaccines or medicine. We know that there is no specific medicine for dengue and no vaccines. But when it comes to COVID, we do have vaccines. Okay, so we have an advantage here when it comes to COVID. So I think we have to learn from ourselves, not from countries who have not done well, but from our own public health programs. And how did we achieve this reduction in case fatality rate for dengue? Is by public education, public empowerment, by telling them when to seek medical care, and prevention. And importantly, education of healthcare workers as well. So I think, the vaccine drive is wonderful, but other strategies should also come in. Now, about moving forward, many countries are thinking about how to move forward. We can't be stuck with COVID forever. We were at the pandemic state last year, and this is the year of transition so that we can go into the endemic state. So this is from the Annals of Academic Medicine in Singapore, which is the Singapore Physicians Medical Journal. And how do countries sort of go from the pandemic state to the transition state to the endemic state? Endemic means, just because I know that there are a lot of people who are non-medical who don't understand what endemic means. Endemic means when a disease is present basically somewhere, and people get infection on a day-to-day basis, like dengue. Dengue is here. All the common cold viruses are here. They are here to stay. So likewise, I think the immediate thing that we need to accept, everybody knows it, that COVID is here to stay, but let that sink in, that COVID is here to stay. So if COVID is here to stay, then we need to change our strategy of how we move from this transition state to endemic state. So for instance, quarantine, in endemic state, there is no quarantine, and contact tracing. Okay, it would be symptomatic contact tracing, testing people who have symptoms, and so on. So this is how we should transit. And of course, we don't have to follow the models given by any country. We can look at the models that are developed by ourselves. So we can come with our own methods of moving forward. Now, there are many difficult questions which we don't have a right or wrong answer when we think about how to move forward. For instance, when we can't prevent infections because we can't get rid of COVID, which means that every day a certain number of individuals will get infected. So then the strategy should be to prevent deaths. I think everybody agrees that we have to prevent deaths and severe disease. And we know that certain countries like Israel and many other countries are vaccinating their older population to do that. But now we have to answer this very important question, which there is no right or wrong answer. These are difficult questions. Who to vaccinate? So should we, October, November months, should we give booster doses for the vulnerable or vaccinate the 12 to 15-year-olds? These are important very difficult questions. Now, this is data released from UK, which I will take you through. The number of deaths among fully vaccinated individuals versus unvaccinated individuals per 100,000 population. So this first row is under 18, which is 0 in the unvaccinated versus vaccinated. So as you go on, you see that the older you are, of course, the unvaccinated people die compared to the vaccinated. But the thing is, vaccinated people also die. You see, so for instance, in the 50 to 59 age group, when 9.7 unvaccinated people die, for 100,000 people, one vaccinated person also die. But over 80, of course, 36 fully vaccinated people die. Because this is because vaccination does not completely eliminate your risk of dying, but reduces it. So given all these things, we have to make these difficult decisions where there is no right or wrong answer. Now again, coming to children, UK, of course, has got a bit of cold feet about vaccinating 12 to 15-year-olds because they haven't approved vaccinating 12 to 15-year-olds because they have said that the health benefits from COVID-19 vaccination to healthy children aged 12 to 15 are still marginally greater than potential harms. But having said that, they haven't approved because they are worried about certain things. Now, this is from United States Advisory Committee on Immunization Practices, and this is only males. I haven't put females here. I didn't have sort of room. But basically, the proportion of when you vaccinate 1 million 12 to 17-year-olds, what do you achieve? So when you vaccinate 1 million 12 to 17-year-olds, you prevent 5,700 infections. You prevent 215 hospitalizations. You prevent 71 ICU admissions and 2 deaths. But of course, you get, this is the harm, 56 to 69 myocarditis. So because of this myocarditis issue, UK did not want to vaccinate their healthy 12 to 15-year-olds. So we have to answer these difficult questions. How do we go on from here? Do we vaccinate kids? Do we give booster doses for older people? And how do we move forward next month, the following month, and so on? Because it's a learning curve. Everybody is learning, and there are no right or wrong answers. And media, of course, has a huge role to play. Dr. Upul also spoke about this, that if you get COVID, it's nobody's fault. Earlier, we saw, especially last year and even this year, COVID patients are so much stigmatized. Okay, if you're positive, I mean, this is our university. When a student became positive, the news reported it like this, as if it's a crime. And of course, when COVID patients, when a few patients did manage to escape from hospitals, they were arrested because it was a crime. Okay, so there's such a lot of stigma going on, which need to stop if we are to move forward. And of course, responsible reporting, because it is absolutely important to do investigative journalism and report what is right, and not create hopes in unproven medicine, which might cause a lot of harm. And of course, we brought the deaths of dengue from 10% to 0.1%, with public health interventions without vaccines. But here we have much more. We are armed with vaccines as well. So we can achieve this, provided that we have our own strategy for ourselves. Thank you.
Thank you very much, Neelika. So we've had an outline on some of the issues faced at an individual level by Upul, and then we've got a super presentation by Neelika, who basically has mentioned who has stated that how certain we are of the uncertainty. No one knows, and we are moving forwards in this. But COVID, especially the Delta, is here with us to stay. Now, let me invite Dr. Prasanna Gunasena, who will speak to us about vaccines, medical supplies, and the future. Prasanna?
Yeah. Thank you very much for inviting me for this presentation and the discussion. I think Can you hear what I'm talking very clearly, or
Yes.
do I need? You can.
Yeah, very clear.
Right. Now, basically, I have a few slides, not very much. Like it's important to highlight the things at the moment, the challenges we are facing, as well as what should we do to face the challenges in future. And at the beginning of our, give me 1 second. Now, sorry for the delay. Now, at the beginning of this vaccination program, as you all know, there were few important aspects that we had to concentrate. First thing, the quality assurance of the vaccines, the access to all possible vaccines, all varieties of vaccines, and timely procurement, financing, and preparation of logistics and capacity building to do the rollout properly. State Pharmaceutical Corporation was handed over this procurement of all vaccines by the government of Sri Lanka beginning of this year, January 2021. And the method that we followed to maintain the quality was to procure all the vaccines from the manufacturer itself. Whatever the type, we purchased directly from the manufacturer. We did not go for the third parties to procure any vaccine. And at the same time, some vaccines, even though they are WHO approved, there are manufacturing sites which are not approved by the WHO. And very particular about that fact. And so far, all the vaccines we have procured are from WHO approved manufacturing sites. So these two principles we maintain, and as you all can remember, we had some problems at the beginning of our rollout to supply necessary vaccines. And at that point, there were many third parties came forward to supply vaccines, and a lot of pressure was built, and especially to vaccinate the working young population, to maintain the industry. And I think Chamber also contacted the COVID vaccine task force. And at that time, there were about 30 to 35 third parties came forward to give us vaccines, basically the second dose of AstraZeneca and other vaccines. However, we maintain our position that any third party who come forward to give the vaccine should get the vaccine from the manufacturer and also provide details of the manufacturing site, and that particular third party should have a letter of authorization from the manufacturer. I must reiterate the fact none of these third parties could provide these necessary documents or fulfill the criteria that we pressed on. And there was a lot of pressure on me at that time to get the vaccines quickly. However, I had to step on to the brake and maintain our position to ensure that we should go only for the highest quality vaccines. And you can understand South America, Africa, as well as in India, there were so many counterfeit products identified during this vaccine rollout program. But we can give a guarantee as a country that all the vaccines used in Sri Lanka at the moment and the vaccines to come to Sri Lanka will be directly from the manufacturers, from the WHO approved sites of the vaccines which are approved by the WHO. And the next two, access to variety of vaccines. And since we started our process in January 2021, by this month, that is August 2021, we have completed the whole procurement process to procure the necessary 2 doses to the country as well as the booster dose to cover the whole population which need the vaccination. And if you go by the name, Sinopharm, Covishield, Sputnik, AstraZeneca, Moderna, and Pfizer, all types of vaccines came to Sri Lanka. And we know the Moderna and AstraZeneca, we got through diplomatic sources. We had the discussions with these companies. However, their commitment to the COVAX facility as well as to the other governments caused a shortage, actually inadequate manufacturing to supply to countries like us when we were trying to purchase.
Prasanna, your slides are
Yes.
not moving, Prasanna. Can you put them onto presentation mode? Your slides, it's just the first slide.
Really?
Right. Yeah, and presentation mode, Dan, there is that. Yeah.
Is it moving now?
Not really. It's still stuck in not in the presentation mode.
Wait a minute.
Yeah.
Give me 1 second. I'll do.
Yeah. Okay.
Wait.
If it's not moving, Prasanna, I think better to carry on. Yeah. The slides are not moving. Prasanna, are you there? Ah, that's better. Yeah. That's much better.
Okay, I'll start talking. The slides will be loaded very soon.
Right. Okay. Yeah. Go ahead. Thanks.
Now I think can you see the second slide?
Yes. Yes. We can see the second slide now. Yeah.
The second slide, the right hand side, second box I'm talking. I think I'll put my face also. Can you see me also?
Yes, we can. Yeah.
Wait a minute. Again, it has gone a little bit. I'll go there. Okay, I'll go by this one. Otherwise, it's going to take a little time. Can you see the second slide?
Yes, that's better. Yeah.
Yeah. Now, basically speaking, we initially talked to all the companies and had the agreements done. However, we found that AstraZeneca as well as Moderna were not in a position to give the vaccines. Then we discussed with all possible countries and the embassies to see the possibility of getting down additional varieties of vaccines. The reason was WHO at the beginning informed us, due to the prevailing pandemic situation, the wider variety of vaccines we have the access, we are in a safe, because during the pandemic there can be various unforeseen factors coming in, and we may not get the promised quantities of promised vaccines. So because of that, we have been discussing. We actually spoke to State Department of United States of America as well as other stringent authorities like US, European Union, Japan, and Australia. So as a result of these discussions, US State Department agreed to give us 1.5 million doses of Moderna, and the Japanese ambassador, after our discussions, agreed to give 1.4 million doses of AstraZeneca, and which was ultimately came to Sri Lanka to fulfill our needs of the second dose as well as to vaccinate people in Kegol district. Now, next step was actually we had to do a lot of work to do timely procurement of these vaccines, and we had certain challenges which are sometimes pertaining to our local issues as well as our global issues. And the registration was the challenging one. I think Neelika is also here, because the data, safety data as well as immunogenicity data were coming slowly, and no country knew everything about these vaccines. So the regulating authority and the experts had a very difficult time to go through all data and find out what is the best vaccine to Sri Lanka. And getting the WHO approval by a vaccine helped us to expedite our process, yet there were certain important issues to be addressed by the experts who were in the process. And especially this has to be considered in the context of the indemnity cover. Now, based on the indemnity cover regulations and the clauses of the agreements, the suppliers don't take any responsibility of anything. It is the purchaser or the government has to take the full responsibility of any complications, side effects, deaths, or any situation that can cause problems to patients. The purchaser, that is the Ministry of Health and the State Pharmaceutical Corporation, has to take the responsibility. And we discussed those problems in length with the Attorney General's Department. And we have a global coverage of immunity in our immunization program. National Immunization Program has a cover for any complication that can arise due to vaccination. So we use that coverage, and we decided that the government will take the responsibility of all the complications or any problems arising from vaccination, and the cabinet has given the approval to go ahead with these agreements. And that is one reason these suppliers did not want to supply any of these vaccines through private dealers, because the private agencies, the local agencies, were not in a position to take this huge burden of indemnity cover for all the vaccines they procure. And also, we had to face the challenge of all suppliers, and due to various globally occurring events. As we know, Covishield vaccine initially promised us to give more than 10 million doses, but they could only give up 1 million doses. And Sputnik also 13 million doses promised, but they could not even made up to 500,000 doses in total. However, because we had a wide variety of vaccines, we were able to get the necessary quantities that is required to vaccinate the total population stipulated by ACCD. And at the time we started our procurement, many countries like European countries, America, as well as many Asian countries who are wealthy have booked their quotas, and every day that we delay our procurement, we were going back in the queue. So we started our registration with Sputnik. When we started our registration, we were at the second place in the whole world. But by the time we start procuring, we were at the 55th place. So that is the global demand that we were fighting with each other. However, we were able to manage and get the necessary quantities that is required to our country. I'll explain the numbers at the end of my presentation. And at the same time, we had to face the financial issues. So far, we have spent 46 billion rupees for the vaccines we have procured already, and we have to spend another 30 billion rupees. Total come to 76 billion rupees. That includes the third dose. And we had discussions with World Bank and Asian Development Bank, and we should be happy. They qualified State Pharmaceutical Corporation as the first institution in Southeast Asia to be eligible for the World Bank and ADB loan to procure vaccines. And they especially looked into anti-corruption and anti-bribery clauses and the procurement methodology we follow in our institution. So now all the vaccines are funded by two agencies, and total necessary finances have been found, and almost everything has been paid already. So it's a matter of time that we are waiting for the vaccines to Sri Lanka. The last challenge we had to build the capacity as well as provide logistics. When we started our procurement process, there was a huge discussion, big discussion about how to store -70 vaccines in Sri Lanka, and are we in a position to do that? And even Ministry of Health has their doubt to find how to find the logistics and the storage for this. However, State Pharmaceutical Corporation, in collaboration with the Central Blood Bank, upgraded their storage facility, and we created a storage to store minimum of 2 to 3 million doses of Pfizer vaccine at a particular time in Sri Lanka. And we are in the process of getting down 2 storage facilities, which will reach Sri Lanka next month, that can accommodate up to 10 to 15 million doses at a particular time. So logistics wise, we are not having any constraints. And at the same time, we needed -20 storage as well as transport trucks. The epidemiology unit usually have -20 plus 2 to 8 degree storage. However, we had to get additional resources to store these vaccines so far in our system. At the same time, there was a huge challenge to dispose these biohazard items in an environmental friendly manner. So we did everything, and all these vaccine manufacturing companies as well as the WHO very closely monitored the disposal mechanisms. We had to adhere to those. So with these two things, I think these are the things that we followed. And in the future, the decision has to be taken whether we are going to vaccinate the population every year. So if it is going to be vaccinated, whether the government should provide total vaccination like we have done in 2021, or whether people should be allowed and the private companies should be allowed to do the procurement, and whether we are going to give people a choice to select whatever the vaccines they would like to take. So that's a matter to be discussed in the policy level and take a decision. And so far, if we take total vaccines we have got so far is 27 million. And out of that, you can see the figures. I don't have to read these things. And out of our total population, I think I must say one question was also there. Above 18 population, so far we have given 83% of first dose and 62% of second dose. And if we take the whole population, we have vaccinated 59% single dose and 44% two doses. So this is the last slide, and this gives the overview of what I have already. And we are expecting 4 million doses of Sinopharm on 18th of this month. And Sputnik has confirmed they are going to give 120,000 doses that is required for the second dose next Friday. And in October, we are getting 4 million doses of Pfizer in addition to 75 doses every week coming in this month. And in November and December, we are getting another 14 million doses of Pfizer to be used as a booster whenever it is necessary. So this is the plan and the action that we have taken so far to make sure that the most important thing, most important weapon against COVID pandemic. And I think so far we have done fairly all right. And I think the rollout program is going on. So we believe that our necessary targets will be achieved according to the predictions that we have done in the coming few weeks. And in future, we have a plan post-marketing surveillance studies in collaboration with the University of California, Faculty of Medicine, Ragama, and it will be conducted soon. And at the same time, we have discussed with WHO as well as the National Medicinal Regulating Authority to upgrade one of our facilities in Sri Lanka, which has the capacity to manufacture vaccines. And once the WHO gives the approval, I think it can be started as a filling factory, for which I think any vaccine manufacturing company can come and discuss and have agreements to manufacture. So in future, in addition to the importation after procurement, we are planning to improve a facility that will give us opportunity to manufacture the vaccine also. And I think I won't take much time because the time has gone. If you have any questions about the medicines and the other drugs and pharmaceuticals, I'll be very happy to answer these questions. Thank you very much for giving me this opportunity. Thank you.
Thank you very much, Prasanna, and thank you to the three of you for doing a wonderful job. Now, let me begin with the questions. We've got several questions coming up in the chat box, but there are three questions which we have been requested to ask you, and then we get on to the chat box also. The first one relates to the current vaccination program, and when do you think this, when do we think that 70 to 80% would be covered? Prasanna or Nilika?
Yeah,
70 to 80% of the population?
Yeah, as I said, even now, already 83% of above 18 population had the first vaccine. And so far, second vaccine has been given to 62% of above 18 population. And with the 4 million doses, which is coming 18, I think by the end of September, we will be able to cover more than 85 to 90% of above 18 population. I think almost 100% of above 18 population can be achieved by first week of October.
Excellent. Now, the other point is, as Nilika mentioned, we are going to live with this virus. So is there a place for testing immunity before we give the boosters, or how do we do that? Nilika, any
Yes, so the WHO and many other organizations have said not to test antibodies before giving boosters. Now, this is because, I mean, if you look at the population, you can't be doing antibody tests for millions and millions of people and then finding out who has low antibodies and give it. That is absolutely not practical. In certain circumstances, maybe like if it is a severe immunocompromised patient who is on chemotherapy for cancer or a transplant patient, then maybe you can do antibodies and give a booster. But I believe when countries have decided to give boosters, like Israel, US has also started, and I believe UK will be starting giving boosters, but not right now, towards more like end of October or early November before winter. That will be for all those categories. They would initially start with individuals who have severe comorbidities, old individuals, that is, who have cancer, kidney transplant, or chronic kidney disease, and so on, and then move down the high-risk age groups. So different countries are having different strategies. So I think it's important to have a strategy for Sri Lanka, because the strengths and weaknesses and the disease prevalence and everything is different from each country. And I think the strategy here needs to be prevent severe disease and death rather than infection. I don't think we can prevent infection, because we know that even people with vaccinated individuals are infected and can transmit. It's most important to prevent the deaths.
Thank you very much. And then there was this question of how do we manage a person who develops the infection, because there is always this worry that they can get back home and then have a relapse or complications later on. Upul, are you around? Will you be able to answer that? This relapse after undergoing all the treatment. I don't think Upul is connecting. Right. Okay. Let's get on to another. Neelika, would you like to tackle that?
I'm not a physician, but I mean, probably you can do it better than me, rather than asking me. I think you are better to answer that question. But I think people, what they mean is sometimes towards the end of after 10 days, people develop pneumonia. So especially people who are taken to these intermediate care centers, they can be okay at day 10 or not bad after day 10, and then they are sent home and they develop pneumonia on day 14 or something, and then you call that a relapse, so on. So there have been enough instances where people have been sent home on day 10, but that's when they actually develop the complications and then have to come back to hospital with severe pneumonia. So I think this day 10 sending home or saying somebody is okay depends on that you're actually okay, that you don't have symptoms. If you do have symptoms at day 10, you have to be careful and assessed to see if you're okay.
Thank you very much. And that's where this oxygen issue comes in. I think it's important for people to realize that the danger of this condition is that the oxygen levels can fall in your blood without you noticing it. And that's why this Upul, Dr. Disanayaka mentioned about investing in a pulse oximeter. And you would have seen some of these clips of people suddenly collapsing. And that is because you are okay when you are seated. When you walk a little, your oxygen level goes down. And if you do that too often or to a longer length of time, your oxygen levels can be dangerously low. And unlike in other conditions, you don't feel it. You don't feel it until you collapse. So that's why these people, you would have seen these, horrifying clips, which is rare, but that's something which we have to think about. Now, the other point is, since we are going to live with this, Neelika, how important it is to use well-ventilated areas when we require to meet people, because if Delta is going to be with us, I think we think that the way we live has to change, because
Yeah,
the
Mr.
way
Saraj,
we,
good evening.
the way we live and the way we meet people, having officers with ACs where we are all cooped up has to change. What do you think?
Absolutely, sir. So I think when we are moving forward with it, because we can't be closed for all the time, and we know that Western countries who have actually achieved over 60% of fully vaccination of their population have opened up, and they're going with their normal day-to-day activities. But of course, those countries are at a disadvantage because they can't have open ventilation when they have winters, and those offices or houses are not built like that. Whereas we have this advantage of having a very good climate. So I think because of that, it is quite easy for, I mean, it's hot, it's true, but there are things called fans. I think we'll have to change these ventilation systems that we have in our offices, our workplaces, for at least a certain period of time, till we, at least a year or so, until we get to know more better about what is going to happen. Because right now, yes, Delta is here, but whether we will get a new variant which is even more transmissible than Delta, will we ever get other variants which will escape vaccine immunity? I mean, those are big questions that nobody would be able to answer. So we have to go with the best available evidence right now to move forward. And I think one of the important ways is to actually improve ventilation to reduce transmission between individuals, because ventilation is known to be quite important.
Thank you very much.
Can I also my
Yes,
opinion?
sure, Prasanth, of course.
Well, the thing is, when we started this whole process, we were unaware of many factors. Now we are slowly understanding what is happening, and people basically would like to go out and have a life. We can't be confined to homes and doing only online work and live until we die. So if the take-home message is going to be like that, it's going to be very, very boring about the future. I think there are certain principles that we already follow that has given good results, like social distancing, hand washing, remain in our home as much as possible. So we have to, first thing is the environmental factors, as well as you need to do exercises, have a good diet, and have a healthy life, control your comorbidities, and take the minimum necessary precautions. And then we have to see what's happening. So, well, if we follow all these things and if still we are going to die, okay, can't help. We can't just, refrain from everything and be in a shell and after 30 years. So there's no point just remaining like that. So positively about this thing. We should not go like, mad people into crowds where there is a possibility of getting the illness. But we need to have our own guidelines, follow the guidelines properly, and try to live a normal life as much as possible. So I think that's a possible thing because, even before getting this Delta wave, the virus, even before the vaccination, we have been hanging around in the hospitals with the necessary precautions, but still we survive. And now with the Delta variants, with some bit of vaccination, probably we might get the infection, but still we are surviving while we are practicing the necessary minimum required. So we should not unnecessarily get afraid of this problem, but we need to spend our life in moderation, a balanced life, a good healthy life. I think that should be the my view towards the 2022, rather than just thinking about various dangerous possibilities that is going to come up. It might come, it might kill the whole human race, but what can we do then? We can't do anything. We have done the best possible things that we can do. Then I think we have to face the reality, and life should go on. That's my view on this.
Thank you very much. While I'm going to now hand over to Amanda because she's keeping a track of the chat box. Maybe we should be thinking some bright Sri Lankan entrepreneurs should be thinking of masks which are transparent. I mean, that's going to be an absolute winner, because if you really have transparent, safe masks, we won't have any reluctance to wear this even in public. Anyway, Amanda, have you got any questions you want to pose to the panel?
Yes, Professor. I
Yeah,
think
please.
Doctor. Yeah, we have quite a few questions coming on the chat box, but I think Professor Malvike had been responding to most of it. Let me just ask a few questions that had not been answered so far. I think this is directed to Dr. Malvike herself. It states fatalities are mainly linked to severe pneumonia, considering that we have to live with COVID for the rest of our lives. What future medical advances do you envisage will ensure that it will not develop in patients?
Yes, so several. First of all, I think we will get better vaccines. I know we have fantastic vaccines, but of course, there is room for much more improvement, and that's how science and technology develops. Already, we have so many other different type of vaccines being developed under phase 2 trials. So maybe, although Dr. Prasanna asked the question whether we would need yearly vaccination, maybe we won't at all, and we can give particular vaccines to susceptible individuals and get over with it. Or on the other hand, we have infections like influenza, which have been with us for, I don't know, like thousands and thousands of years. And we know that such vaccines are only given to older individuals or susceptible individuals before like the winter comes or the end of, like influenza season comes, to prevent severe pneumonia again and death. Now, apart from other medical advances over this year as well and last year, clinical trials are going on for so many drugs to treat COVID. And we do have effective drugs to give for severe pneumonia, not for mild, like dexamethasone, which is abused for mild as well, unfortunately, in Sri Lanka. And other drugs like certain monoclonal antibodies, tocilizumab, which is given for severe pneumonia. But there are lots of research going on to find drugs that can be given very early on to treat. So I think, of course, within the next 6 months or 1 year, we will see huge advances in medicine to treat this. So I don't think we need to be worrying all the time. I think this is why I was talking about the role in the media and anybody who speaks to. I mean, we've been in this doomed mentality for a long time, but if we understand that this is going to be here forever, we don't like that. I know. I mean, nobody likes to accept that COVID is here to stay, but it is. So some unfortunate things in life we have to accept, and after we accept, then we have to find a strategy. Okay, what is the best way for us to move forward? And yes, thank you.
And from a state pharmaceutical corporation side, I think we have written to a couple of companies that have completed phase 3 trials of some antivirals in United States of America, and we are getting down the data, and we'll be handing over this data to National Medicine Authority for the review. And I think probably, as Nilika said, some kind of a cure for this illness, or I mean severe illness treatment modalities, we are also thinking, and we are working on that at the moment.
Thank you. Amanda, any other questions?
Yes. We have another question. It states, what are the parameters and test methods to check the immunity boosting up in human body after vaccination?
Okay, so after vaccination, immunity boosting in the sense like after you get any vaccine, we know that we got, when we were small, we got the triple vaccine, then, which is whooping cough, tetanus, and diphtheria. So even if we check now, we have antibodies to some of them. So we know by checking antibodies that we have responded to the vaccine. Now, for some vaccines like tetanus, we know that the antibodies don't last long. So this is why after some time, if you have been, cut injury or something, you need to have a tetanus toxoid. So similarly, with COVID, antibodies or this immune response is not long lasting in some individuals or most individuals, and certain individuals will need to be given a booster, which we will have to decide. But you can see if you have responded to the COVID vaccine or any of the childhood vaccines by checking your antibody levels.
Thank you.
Thank you, Professor. There's one more question. After 14 days of quarantine, is there any way forward action on extending testing to identify multiple organ dysfunction syndrome apart from the PCR before discharging from the COVID treatment centers?
Yes, so the PCR is not done to actually find out if you have multi-organ dysfunction, and actually according to the Ministry of Health guidelines, after somebody is PCR positive, you don't repeat the PCR until 3 months. This is because once you're PCR positive, you can have remnants of dead virus for a very long time, which will be picked up by a very sensitive test like PCR, and then you will be positive. So we know earlier, like the beginning of the pandemic, people were already sent home when 2 PCRs taken 24 hours apart were negative. And because of that, most patients stayed for more than 1 month, and some patients even more than 2 months in hospital at IDH. And later people realized that actually, although PCR positive, these are dead virus, does not infect others. So it is not needed to do PCRs. So in Sri Lanka also, the Ministry of Health has put out a circular saying, once you're PCR positive, there is no need to repeat your PCR until 3 months. So there is no need to do that. To look at multi-organ dysfunction and other parameters, PCR doesn't help. To see if you have lung damage or something like that, you do pulse, this pulse oximetry, which Dr. Upul Disanayak and Professor Saroj were talking about. And the other parameters, the doctor would examine you, and based on your clinical features, the test would be decided. I think Professor Saroj can add to this.
Yeah, I think I don't have much to add to that, Nilika. I mean, as you quite rightly mentioned, we will have to watch the clinical progress and then decide on discharge in most instances. And also, I think as we go along, this emphasis on testing large numbers of people is going to recede, because we are going to have a situation where only when a person is symptomatic that we'll have to know whether if a person has got symptoms or obvious contact with someone, that we'll have to do the test to identify whether the person is having COVID, what we call syndromic management. So you see, the strategy is being changed in the country based on certain very dynamic situations, and unfortunately, I think that communication is not getting through. So we change things because the government is changing things based on certain data which is coming in, and now, in fact, the lockdown has the restrictions have been extended mainly because of the data which Professor Nilika's team have provided, saying that Delta is all over. So I think it's important to realize that everybody is in this phase of uncertainty. And we have to be very, very thankful that we didn't have the first wave. If we had the first wave, like Italy, I mean, most of us would be dead, because at that stage we didn't have a vaccine. We didn't know that dexamethasone could be used. We didn't know that masks would have saved us. I mean, WHO was saying no need to use masks. We didn't know anything about ACs and people spreading it in ACs. So if that first wave really hit us, we would have been dead. And also, I think this brought up some very interesting complexities in relation to getting the vaccine. And Prasanna outlined so many issues which are there in relation to vaccines, getting them authorized, getting them the indemnity sorted out, competing with so many other countries, which some of the countries we know are hoarding. So there's another point before I forget. You see, there is a helpline which has been put up by the Sri Lanka Medical Association and and the Mobitel SLT. It's 247. So any person who falls ill with COVID can get information through 247. It's a free service. Second thing is the National Operations Center also has an SMS-based service. It's 1904, 1904. And that again is when you have the information that you want to find out if you have COVID and what you want to do. And of course, the Ministry of Health, through its network, the widespread network of PHIs and MOHs, they also have a system, and all these are working together. And that I don't have the number with me right now, but that's also given in the Health Promotion Bureau website. Health Promotion Bureau website. That's the official website of the ministry, which tells you all the details and all these interviews happen. So I think those are a few points I would like to make. Amanda, any other questions, please?
Yes, Professor. I think this would be directed to Dr. Prasanna. It states, is there a reliable testing method in Sri Lanka regulatory bodies to check COVID-19 related vaccines prior to introducing it to Sri Lanka internally to check the suitability? And if yes, is it available for public review on a website or in sort of a publication? Or if not, how who will be responsible in terms of this?
I didn't get the I couldn't hear it properly. First part of the question. Can you please repeat it?
It's asking. Okay, the question is there reliable testing methods in Sri Lanka regulatory bodies to check COVID-19 related vaccines prior to introducing it to Sri Lanka internally or to check the suitability? And if yes, is it available for public review? And if not, how would your team be responsible?
I think the question is a good question. I think our expert committee member Neelika is there. I think she will further explain it. Now, this vaccine is a biological product, and National Medicinal Regulating Authority has to go through the clinical trial data, the manufacturing site data, safety data, as well as efficacy data. So these are the things that they review. There's no specific test to do to say that it is effective or not. And the data will show whether it can be used for us or not. And the WHO or any other stringent regulating authority in the world would follow the same mechanism. And whenever a lot of vaccines come to Sri Lanka, the manufacturer issues a certificate of analysis and a lot release certificate that contains all the bacterial content, the contaminations, the composition and everything. And once the company issues the certificate of analysis and the lot release certificate, the regulating authority in that particular country issues another certificate after reviewing and checking the samples. And when the vaccines come to Sri Lanka, Medical Research Institute has a separate unit that review again these certificates as well as the samples, and then the Medical Research Institute, which is an independent organization, issues a certificate that these lots can be released to be used in public vaccination. That is how it is, I think, done in routine manner. I think maybe Professor Neelika might add a little bit more how to, make sure that the vaccines are good or bad. I think that's the question.
Yes, I don't think I need to add more to that, but just to brief add to what Professor Dr. Gunasena said, when large clinical trials are done, so all these vaccines that are evaluated by this expert panel at the NMRA, they go through all the clinical trial data, so these vaccines are assessed in thousands and thousands of people, usually more than 20,000, 30,000 people in different countries. So it's not just one country where these vaccines are evaluated, but in different countries, in different ethnicities. And based on that data, you go through all the immune response data, the efficacy data, the side effect data, and based on that data only the committee evaluates that data and then decides. The initial thing that the committee decides is whether the vaccine is safe or not, because you are injecting a vaccine to healthy people to prevent the infection. So the number one thing is whether the vaccine is safe, and if the vaccine is safe, how effective the vaccine is. So this data is evaluated based on all the trials which are done, and all this data is freely available to anybody who wants to look at them. They're out there in the web. Thank you.
Thank you very much. Amanda, any other questions?
Yes, we only have 5 minutes, so I'll just wrap up with a few, maybe 2 more questions. There's one question earlier, if anyone from family is identified as a positive, MOH asked to do a PCR for that family member too. But now, even though the family members have symptoms, they are not doing any tests, and the PHI is asking to treat as COVID-19 positive patients. Is that the correct way to do? If yes, how can we rely on the statistics shown by the government?
Yes, so maybe I will answer and then Dr. Prasanna will go ahead. So with the Delta variant, if a member in the family is infected, then it is very unlikely that the other members in the family are not infected because it's so transmissible. So this is why you can't get rid of Delta or this COVID. So let's say the father is infected and the mother and the children have symptoms, invariably they too have infection. There is no question about it. And of course, when you look at the PCR positivity figures, let's say the government says 3,000 positive, 4,000 positive, or I don't know, whatever number, that is of course after tested. But for policy making and epidemiologically, for every 3,000 or 4,000 or whatever number positive, there are at least, I don't know, 3, 4 or even 5 times positive individuals in the community, symptomatic and asymptomatic. So that is with all infectious diseases. So especially when an infection causes disease without showing symptoms, because now we know that the mother and father mostly show symptoms, but the children are fine. Most of the instances they don't show any symptoms, but obviously the children also get infected and they are not counted. So this is the same with other infections like dengue also. When a family member has dengue, in other countries for research they have tested the other family members who are also infected with the virus. But of course they don't show symptoms. So even when we say that for dengue, now I showed you, like in 2017 we had almost 200,000 cases. Those are the reported ones, but the actual number of cases would have been like 2 million possibly. So with all infectious diseases, so when it comes to COVID, this 3,000, 4,000 or 5,000, whatever the number we are putting out, that is of course only the tested positive number. There will be lots more in the community who are actually positive. Thank you. I don't know if Dr. Prasanna wants to add to that or Professor Sarosh wants to add to that.
Yeah, I think this links with what I was mentioning, that the strategy has to change now, because when we know that it is spreading very widely, there is no point in trying to test and say, this person has got it, the other person has got it, because we assume that everybody has got it, and we want to do something only if that person is having symptoms like fever, cough, and so on. And quite rightly, with that strategy, once we accept that we are going to live with this, there is no point in looking at the figures in detail. But not that the government or the health authorities are ignoring those, because you can still use those statistics to good effect. For example, we know that the death rates are very reliable. So the deaths are being monitored very, very carefully. We know that the ratio of testing to positive gives us some indication, and there are mathematical ways of predicting how many might be out there. So even though the media highlights just the raw data, there are a lot of brains working behind the scene to try and make sense out of this data and to plan out what needs to be done. So I think a change in strategy means we won't be bothered so much about a particular family member having it, and what the PHI is saying is correct. Thank you.
Thank you, Professor. Just two more questions in the interest of time. Can a PCR indicate not detected if the PCR was taken after 21 days of being symptomatic?
Yes, so 21 days after symptomatic, some people completely clear the virus. So after 21 days, the person PCR can very well be negative. So although some people would be PCR positive even on day 21, some people may not be. So that is completely normal for the PCR to be negative on day 21 in most people.
Thank
And
you,
also,
Professor.
just because the PCR is positive does not mean that the virus is alive on day 21. Is that right, Neelika?
Yes, absolutely.
So one last question. If we have taken any of the COVID vaccines, is it okay to take the tetanus if needed?
Yes, provided that you leave a gap of 2 weeks. So you need to leave a gap of 2 weeks between the two vaccines unless it's an emergency vaccine. So let's say you got a COVID vaccine today and you are bitten by the dog like tomorrow and you need the rabies vaccine, then of course you don't wait for 2 weeks to get a rabies vaccine. You take it immediately because we know that rabies is lethal. Mortality is 100%. So in such instances, you don't wait, you just go ahead and get the vaccine. But if it's a routine vaccine that you need to take, the advice is to wait for at least 2 weeks.
All right. Thank you very much. I think we've covered most of the questions, but probably we would have missed out on several. But in the interest of time, and also these panelists have joined us with their very busy times. Professor Saroj, we can wind up.
Yeah. Thank you very much once again. We're sorry there were a few technical glitches, and it's been a pleasure. I'm sure the three panelists also enjoyed interacting with all of you. I think the take-home messages in this very, very dynamic situation is that we have to be prepared. This is going to be with us, COVID, Delta, and it's going to be with us. So we should not have any sort of stigmatization of people. And the vaccine rollout and the plans for vaccination is on schedule. And there will be other therapies which will come and help us in the management. And do not fear it. The maximum investment proposed by Upul is to have your other drugs, whatever you have at home, ready, and maybe a pulse oximeter of good quality. Then remember those phone numbers and the 247-1904, and also some of the reliable websites which are out there. I think there are 2 points which we have to highlight. One is, if you're taking any drugs for other illnesses, please continue those. Please continue those. That's very important, because we don't want people to be falling ill with other illnesses at this time of a pandemic. And the final point is, if there is anyone out there who has not got vaccinated, just tell them to go and get whatever vaccine which is available. Don't try to choose between A, B, and C, right? Just get the vaccine which is available there, and we can assure you that a lot of thinking and regulatory things are in place before vaccines are recommended. Obviously, in a situation like this, there will be pilferagers and small things happening and people queuing up. It's very, very sad that when 95% of the things are functioning well, the media tends to highlight those small things, and people tend to they lower the value of this main strategy, which is vaccination. So I think those are my parting words, and thank you once again. Amanda, just a final goodbye from you to everybody.
Thank you very much, Professor. Thanks a lot to all our panelists. On behalf of the Chamber, again, we really appreciate this time that you spent with us. And we had a full house. We had almost 200 participants logged in for this session. And as I mentioned earlier, we have recorded this, and the recording will be shared to you. as soon as we can, and we will also upload it on the Chamber Academy YouTube page. Before we close up, I would like to thank our sponsors once more, London Stock Exchange Group and Hutch for supporting us initiate this webinar. And Professor Saroj, thank you for being an excellent moderator for this session. And thank you very much, all of you, for your time. Have a great evening. Thank you.
Thank you. Thank you very much. Okay. Bye.
Thank you. Thank you.
Stay safe. Bye.
Bye.
Okay, thank you. Bye.